Good afternoon, everyone. My name is Wendy Myers. Welcome to the Live to 110 podcast. We're broadcasting live from Los Angeles, California. Today I'm going to be interviewing Dr. Nisim John about natural treatments for cancer and the problems with chemo and radiation, which is obviously the standard treatment in the U.S. for cancer. And I'm intensely passionate about informing people of natural cancer treatments because my own father passed away from his treatment of esophageal cancer. Mind you, not the cancer, he died from his treatment. He lost 120 pounds in 4 months while doing chemo and radiation, and obviously this destroyed his health and immune system, and he basically didn't have a chance after these treatments. And additionally, his tissues had become so weakened from the chemo and radiation that when he had surgery to finally remove the shrunken tumor, the stitches couldn't hold and he bled out and died. So after this happened, it dawned on me that I probably should try to figure out how to prevent cancer because I definitely did not want to go out like my father did. It was years of misery and pain. And I also began studying all about cancer treatment prevention to try to figure out why he died. And I was very surprised and disgusted by what I learned. And every time I hear of a friend or a loved one getting cancer, I am just sickened by the fact that the only options that are offered are chemo, radiation, and surgery. And I frankly think it's a crime that when we have so many options available at our disposal to fight this plague in our society. People need to learn their options because they're not getting this info from their doctor, and we'll learn why during the show. But before we get started, I do have a little disclaimer. Please keep in mind that this program is not intended to diagnose or treat any disease or health condition because that would be illegal. Live to 110 Radio is solely informational in nature, so please consult your healthcare practitioner before engaging in any treatment I or Dr. Nisim John suggest on the show. So let's get started with the show. I'm really excited about this topic, and today we have Dr. Nisim John of Integrative Cancer Treatment Centers, and you can visit his website at canceroptions.us. Hello, Dr. John. How are you doing?
I'm very good, Wendy. It's an honor to be on your show. I'm very excited to be here, and I hope we could do some good with some information that we'll be handing down to people listening.
Yeah, I do too. And so let's start with telling the listeners, what's your story? What inspired you to treat cancer using the natural methods and open your ICTC clinics?
Well, I want to, my heart and love is towards you and what you went through with your father. There's a lot of people out there, there's millions of people that go through these types of developments when a family member or friend, is diagnosed with cancer and then treated with these conventional methods. But in regards to my story, I started medical school and I started working for a very well-known alternative therapy doctor that has been around for like 60 years. He actually started the whole alternative treatment in the mecca of alternative therapies for cancer in Mexico, in Tijuana, Mexico, which is 10 minutes from the Mexico-San Diego border. That's pretty much where all that started a long time ago. So they actually brought me in, and they wanted me to do research for them. And I started doing research in my first semester. I started doing a lot of research in regards to stem cell and how it would help cancer, and just the list goes on and on about poly-MVA and Sono-Photo therapy, et cetera, et cetera. So by the time I was in my third year, I pretty much was well known. I knew a lot of what was going on in the world in regards to alternative therapies. Excuse me. So by the end of, and then I obviously did a lot of work with these doctors and saw a lot of the good results that they were having, and how they were so different than the conventional doctors, how they knew a lot more than what was out there, and also my experience with all the research that I did, hours and hours and hours, because as a medical student, you really don't have that much time to get a job, like a regular job. So my job was staying up when I had the time and do a lot of research throughout the world. I would contact people from Kiev, Russia, and Germany, and all kinds of different places to get information from them and things like that. So that's how I got started. And then by the time I was done, I knew what I wanted to do afterwards, to specialize in integrative therapies for cancer and other diseases. Because we not only treat cancer, there's other treatments for degenerative disease or autoimmune diseases. Diabetes is not something that needs to be given so many chemical drugs throughout the rest of their life, or people losing their feet or their limbs and things like that. It can be stopped as well.
Yeah, and so you own the Integrative Cancer Treatment Centers, and where are your clinics located exactly?
Our main clinic is in Mexico. It's 20 minutes from the San Diego Airport. I'm sorry. So if you land in San Diego, California, in the United States, you drive 20 minutes south, and the clinic is in Tijuana, Mexico. It's by the beach. It's a very nice area, and pretty much that's where all the very good clinics are for these types of therapies. And then we have other branch clinics in Israel, in Tel Aviv, and in Germany, in Bad Bergenher. It's southern Germany, and we're planning on branching out to other parts of the world as well. We're working on a few places in the Middle East right now, and also in South America.
That's fantastic. Yeah, I just love that you're doing this work. And I'm curious, why don't you have any clinics in the U.S.?
Well, the problem with the U.S. is that it's really tight and regulated in regards to using anything but chemotherapy and radiation to treat cancer. So once you declare that you are going to use other therapies, cancer, then they're going to shut you down. They're going to, some of my colleague friends have been locked up. There's a few friends that are in jail now because of that. And so really we're really restricted about what we can do as doctors in the United States in regards to treating cancer. A clinic up in the U.S. and say, yeah, well, we treat cancer here, but we don't use chemotherapy or radiation because, it's a $1 trillion business, and the one treatment alone will range you from $1,000 to $30,000, and it's mainly on the high end that the first treatment is going to be. So you figure it out. This is making a lot of people a lot of money, and the problem with that is that it's okay for people to make money, but the problem with that is that the success rate with these treatments are like 1% to 2% success rate, which means a remission. Yeah, remission of 5 years or longer, 1% to 2% from 100%. So
wow.
The people are really. That's one of the things that we're trying to do is educate the people throughout the world, not just in the United States, about what really is going on with these types of therapies in regards to chemotherapy and radiation. Sometimes surgery is good, but a lot of times, it's not. It depends on the situation as well.
Yeah, it's amazing to me that almost every day I read a different story about an alternative cancer treatment center or clinic getting shut down by the FDA. They get raided, and the doctors lose their licenses or put in jail, and it's like a cartel protecting their investment. Because the FDA basically, in my opinion, their clients are the pharmaceutical industry and the companies that make medical equipment, make the mammogram cancer testing equipment, and these people want to protect their investment. And it's in fact illegal for a doctor to prescribe anything other than chemo and radiation in the United States because of that reason. The doctors could lose their license and face malpractice suits, etc. And I've heard of and it's very odd to me that if you're curing cancer, you would be shut down or harassed by the FDA. It's just, like I said, to protect the pharmaceutical and medical equipment manufacturers' interests, because they make billions and trillions off these diagnostic tests and cancer drugs. So
it's a vicious circle. If we were to get all the information out there to prevent diseases, there will be a lot of people losing a lot of money because most of the pharmaceutical companies are not here to cure diseases, let alone prevent diseases, but they're mainly to maintain, a stability of the disease. I mean, how many people do you know, and the people that are listening know that you go to the doctor and they say that you have high blood pressure and then you have to take these pills the rest of your life? I mean, really, you have to take 3 different pills for high blood pressure for the rest of your life, when 2 or 3 things that you could actually do on a daily basis could get your blood pressure 10 points down, and eventually you won't need to take any pills. So it's a vicious circle. And I had a few friends of mine that, for example, I had a doctor friend from the United States, got everything from the United States, his degrees, et cetera. He started a company on the internet selling a product that he came up with and he sold it through the internet that was having great results for cancer. So they went to his office and shut him down. So he moved to Ecuador. In Ecuador, he did everything legal. The reason he moved to Ecuador was 2 things. One, because there was a lot of herbs, plants, and different things that he was working over there, so he was closer to that. Plus, it's cheaper to live there, and it was everything that he was doing was legal. So and then he started selling the same products again throughout the world and through the internet, and the patients were getting really good results. So what happens? The FDA sends agents to Ecuador and arrested him.
I know who you're talking about. What's his name? I've heard his story before. I'm advised not to get into that right now. Oh, okay. Yeah, I read something about it on naturalnews.com. I read it. He had a podcast. He was interviewed by Mike Adams. It's a very sad story.
Yeah. So, things like that happen, and the judge of the town went to the airport to stop these guys and show them that he was legal, he wasn't doing anything. Then they took him anyway. And last I heard, he was still in Miami in a prison. So it's just. And then there's boys, a mom. This is like 5 months ago, and these are like consistent stories that happen over and over again. A mom refused to give chemotherapy from the doctors of her child, so she went to Mexico, and then they accused her of kidnapping the child, her own kid, and then the FBI went to get her in Mexico because they said that she had kidnapped the child because she refused to give him chemotherapy.
Yeah, it's amazing the government thinks they have jurisdiction over your body and they can tell you what you can and can't do as treatment. It's amazing to me. So let's go over some basics. Let's go over some basics. Let's go over some basics. Like, can you tell the listeners what exactly is cancer and how does it develop?
A mutation of a cell, basically. I mean, when you have normal cells and then you have malignant cells, whenever a normal cell turns to abnormal, and then it starts reproducing itself at a rapid rate, and some of them even eat up the normal cells, that's called cancer. And how is it developed? I mean, there are so many different reasons why a disease is developed. And if we're talking about cancer, a study was done in the 70s by Dr. Hammer, a German doctor, and he proposed that emotions had a lot to do with the manifestation of cancer in the body. So what he mapped out is that he mapped out different organs in the body, and he connected an emotion to that organ and concluded that certain emotions will cause certain cancers in different organs. For example, the liver and anger and the liver are related because people that have some kind of anger issue that they've never resolved in their life or things like that, or they were really like abused verbally or emotionally when they were a child or young adult, then they develop cancer of the liver that's related to that. So emotion has a lot to do with the manifestation of cancer. Stress, toxins, different heavy metals, the pH of the body, all are like a combination of things that will develop into community of malignant cells. I say community because when we all have malignant cells going in and out of phases throughout our daily life, but a community that's when the actual small tumor starts to be visible by what the conventional medicine uses now to look at different parts of the body in regards to whether there's tumors or not tumors, et cetera, et cetera. So it's a combination of things that cause these malignant cells to occur. But I from my experience, emotional therapy should be included in every patient that has any kind of disease, especially cancer. So because these traumas, these emotional traumas that people have carrying with them will manifest eventually into tumors, into malignant cells. I mean, and this, I see examples of these on a weekly basis. I mean, so many patients, so many stories, so many people that I know, their grandfather dies, or they get a divorce, or they get abused by their husband. All of a sudden, breast cancer, liver cancer, pancreatic cancer, et cetera, for just like that, out of the blues.
Yeah,
so
my dad was
angry.
My dad was a very angry guy, angry and irritable.
Yeah, so one of the things that we do in our clinics, and what I teach when I do lectures, is that we have to deal with the patient not as just some kind of tumors in some area. We have to deal with everything from head to toe to treatment. We have to deal with the emotional aspect of the patient, the spiritual aspect of the patient, and the physical aspect of the patient, and the energetic aspect of the patient. A long time ago, we haven't really delved into the energy work that is needed also to treat these types of patients, all patients really, but it's also very important to deal with those type of treatments. So it has to be like you have to attack this disease like they attack the body of the patient, like without mercy. You have to really, really focus on every type of modality that works to treat the cancer. I mean, there's a lot of people out there are doing good. I respect them and everything, but sometimes what they're doing is not enough to deal with cancer. So
yeah. Why do you think we're seeing such an explosion of cancer? With almost 50% of citizens in the U.S. developing the disease, and at younger and younger ages.
Well, the technology has to do with a lot of it. I mean, we're most of us are sitting in front of a computer at least 2 hours a day. There's less exercise being done, and the kids are exercising less. They're sitting on computers. There's not enough. And then the GMO stories and the genetic engineering of foods, the pesticides, the bad diets that we have in our country. I'm talking about the United States. The bad influences in our environment and everything else. I mean, there's so many things that are causing this cancer rise, especially here in the United States. I mean, sometimes I walk outside, and I live in San Diego, California. It's supposed to be the best city to live in the United States and the prettiest city. Sometimes I walk outside and I smell pesticide in the air. And I don't even know, I'm not really sure if that pesticide is from because we don't really have fields near here, like really near where I live, but are they like pesticides that I'm smelling, or is it like somebody dropping some kind of chemical in the air? I'm not really sure what that's about, but there's so many different things that are causing this rise in cancer. I think the major thing in regards to that is that people should be aware that it's not hard to get in the right path into good health. I mean, you just have to, try to eat a decent diet. I'm not saying for everybody to stop eating beef if they want to, eat beef, yeah, but don't exaggerate on it. Good, clean your vegetables. If you're like a vegan or, a vegetarian, please wash your vegetables because they are not very clean. Especially if you eat them raw.
Even the organic ones can have some pesticides, especially if they're imported from other phrase, sadly.
That's correct. What I usually tell my patients and everybody else that that wants to hear about this vegetables is that if you put the vegetables before you eat them in like vinegar, like for at least 1 or 2 minutes, and then rinse them with alkaline water, really good water, then you'll be good. It'll do wonders for your health. And also the water has to be really, you have to be careful with the water because, here where I live, there's a lot of, in the water, there's fluoride and all kinds of different chemicals that are really bad. And, so we're going to introduce a filter system that we just developed. And I just got the sample that they made for me. I'm going to introduce it into my webpage. This filter system is like, really, really good. I don't want to get into it right now, but it's it's portable. It has all the protection you need. It has everything. Well, I'll have a video on it later on, and we could talk about it later. But that's another thing that people should consider is the water, and the pH of the water. That also has to do with creating diseases in the body, the stuff that you're drinking. It's so important to get a water that's not acidic or has a high alkaline, base, a pH, like 8 or 9. It's ideal. So we have to also take that into consideration.
So let me ask you a question. Would you ever use chemo in your treatments, or would you ever recommend it to a patient?
I think I used chemo in 15 years. I probably used chemo twice, and It was low dose chemo. It wasn't like the standard recipe chemo treatments that they have, because if you go to New York City and let's say that the patient has liver cancer, New York City or any hospital that's Johns Hopkins or any hospital, Houston, Texas, they're known for having great cancer hospitals. If you go there, a patient goes there with a liver problem, liver cancer, and then you go to the Royal Marsden in London, which is another quote unquote great cancer hospital where they use chemotherapy and radiation only. And then you go to a hospital in Australia that treats cancer with chemo and radiation. They're all going to have some kind of recipe of the chemo drug that they're going to use and the dosages, depending on the kilograms of the patient. So it's not going to vary from one country to another, regardless of what name the hospital is. It could be Joe Blow's Hospital in Beltway, Texas, or something like that, and then you could go to the Royal Marsden. They're going to have the same chemotherapy dosage, et cetera, per milligrams per kilogram. The reason I know this stuff is obviously I've been to these hospitals, and also because a long time ago when I was not even in medical school yet, I used to work in a lab where we prepare medications for patients, and I had to go and suit up and prepare these medications, not knowing what I was preparing, but I was protected from head to toe, and gloves and the goggles and everything, and I was actually preparing chemos. I mean, I knew what I was preparing, but I didn't know what it was doing to the patient. This was like maybe 30 years ago. So I've used low dose chemo. That means we came up with a really low dosage to do a certain thing for the patient, not necessarily to get rid of the cancer. Okay, because there's a few drugs that we could use to treat other things besides the cancer. For example, I had a patient in the Mexico clinic that we had to use a certain dose of a chemo to fix her lungs. She had a lung problem. And when I say we, I'm talking about the specialists that I work with, because I have a team of doctors that I work with. I don't just work by myself, because we have to integrate everything. We have to integrate to make sure that the patient is good in everything in regards to like the internal medicine doctor. If the patient has lung problems, we get a pneumologist, et cetera, a cardiologist, et cetera, et cetera, et cetera. So those are the only cases that I've ever had to use chemo, but it's rare. It's very rare. And I mean, if we talk about the options that people have with treating these diseases, there are a lot of effective things out there that are non-toxic and safe and proven. It's been proven. The reason that it's not in any medical journal is because we never could get funds to do these studies, and no doctor, especially if they're private doctors, going to actually, try to where are these doctors going to get millions and millions of dollars to do these studies and then put them on some journal? They're not going to do that. So
yeah, I'm sure there's not going to be any research done by any large pharmaceutical companies because they want to keep their money-making chemo and radiation very much intact.
That's correct. Yeah, that's correct. I mean, the FDA and obviously the politicians and et cetera, it's just it's like a little triangle. So you're my back, I'll scratch your back. I'll pass laws to just negate anything else but chemo and radiation. And you could help me in my fundraiser to become whatever X, Y, or Z. So that's pretty much how that works.
So what does chemo exactly do to a body?
Well, let me just compare what chemo does to a body. I mean, it's not a really good comparison, but if you ever look at the package insert is the information of the drug that's attached to the bottle that it comes in, or the vial, or the bag. If you look at the package insert, let's say of a anti-contraceptive, and it said side effects, you're going to have like 100 side effects. Okay, that's anti-contraceptive. Now, if you look at a package insert of a chemo drug, and you look at the side effects, you're going to have probably 500. Oh, wow. And the reason that I pick anti-contraceptives is because that is one of the main drugs out there that has the most side effects. Unbelievable. If you really do your research on that, it's incredible. But in regards to chemotherapy, what does it do to the body? Well, it kills pretty much every cell. So if we're talking about brain cells, it'll kill brain cells. If we're talking about the cells of the lungs, it will kill the cells of the lungs, the cells of the skin, the cells of the liver. Every system in the body is affected with chemotherapy. So it's going to kill everything, okay? So, did you ever see Patrick Swayze's picture after chemo?
Yeah.
Okay, did you see what he looked like? So everything, he looked really, I always compare chemo in the way that the concentration camp victims look, when they were in the concentration camps. And by the way, the chemotherapy is linked to that era because one of the doctors that worked for Hitler actually created this. I mean, these concentration camp victims, and I don't want to go off topic, but this is like really close to what we're talking about. If you notice, they were in these camps, but it didn't take them long to lose all the weight and become bald and become really weak and frail, just like what chemotherapy, if given in cycles, does to a patient. It's the same. Yeah. So basically what happened, and I don't know how much information of this is out there, but I've done my work, and I spent a lot of time in Germany. So basically what happened is that this doctor, in his memoirs, he wrote, we didn't when he knew that they were going to be defeated. He wrote, we didn't kill enough people this time, but we're gonna, we created something that's gonna kill millions and millions of people in the future. So he was talking about chemotherapy.
Oh, I didn't realize it had roots.
Yes. So basically, chemotherapy will kill cells in the body. It basically destroys systems. Obviously it destroyed organs, but it destroys systems. So, some people have a lot of cough because their lungs are affected. Some people are bleeders. They have their circulatory system is affected. their immune system is affected, their, every system is pretty much affected. So like I tell my students when I'm giving lectures, is like, let's say you have your immune system this is key, this is very important for those people out there that are listening. What happens with your immune system? If you have, let's say you have 1,000 soldiers, and that is your immune system, the 1,000 soldiers, to defend against any invasion, which means that anything that comes into the body or anything abnormal in the body that needs to be defended by these soldiers will attack it. So what happens when a patient is given chemotherapy? It destroys all these soldiers. So what happens then? Anything that's in the body that's not normal, or it's an invader to the body, there are no soldiers to fight it. Therefore, the body cannot defend itself. So basically, chemotherapy destroys the immune system. The immune system doesn't have enough soldiers or anything to fight the cancer, let alone these other diseases. And you were right at the beginning of the show when you said that most patients in your father didn't die of the cancer, but of the treatment with chemotherapy and radiation. It's true. Most patients do not. Unfortunately, those that pass away, they don't pass away because of the cancer itself. They pass away because of what the chemotherapy did to them, prior to it. Because
go
ahead.
Oh, sorry. Well, when someone has chemo, does it reduce one's chances of recovery from cancer?
Not really. No, it does. I mean, it depends. It depends on the situation. Well, I could just give you a statistic. 2% of the patients that get treated with chemotherapy survive 5 years or more. I mean, what else can I tell you in regards to that? Also, I think 7 years ago, I don't remember exactly how many years ago, but they did a study worldwide. And it's not the Canadian study. A lot of people tell me, oh, that's the Canadian study. No, it wasn't a Canadian study. It was a study done in Europe where they asked oncologists, I think it was 1,000 oncologists that they asked throughout the world, if they themselves or their family members had cancer, would they give themselves or their family members chemotherapy or radiation? Do you know how many said yes?
No.
0.
Wow.
0. So, because what do we learn in medical school? What do we learn in our specialties? Like, for example, oncologists, what do they learn in their specialty? They learn how to dosage and chemotherapy, like how to give chemotherapy. Basically, what chemotherapy drug do they give for this type of cancer, for that type of cancer? How do they measure it, the weight and this and that? And they specialize in giving chemotherapy and radiation. That's all they know. So when a patient goes and tells their oncologist, doctor, but I heard that poly-MVA does this and this and this and this, they're like, no, that's quackery. That doesn't work. Why do they say that?
Can't they never be sued for malpractice if they recommend that or say go do that? They could lose their license or be sued for malpractice if they suggest that.
No, that's not. I mean, they don't really suggest it because they don't know about it. They've never studied it. They've never done research on it. They never spoken. And I'm not speaking for all oncologists, but the majority of these doctors, they have no idea what alternative therapies for cancer do or are.
Yeah.
In regards to suggesting to the patient, that they do not give any prescription to the patient. They could just say, go see this doctor. He's a specialist in alternative therapies for cancer. They're not going to get sued for doing that. They don't need to suggest anything. You understand? Because they don't really know the dosages of poly-MVA IV. And there's not too many people that give poly-MVA IV, especially in the United States. I mean, there's a few doctors that are doing research on poly-MVA IV, which is one of the main antioxidants, the strongest antioxidants that exists in the world right now. And it's given, if you go on the internet, you'll see it as orally, PO, right? But you won't see it as IV because there's only a few doctors, including myself, that do it IV, and we learned how to administer it IV, years ago. but not too many people know this. I mean, even in the alternative world, not too many people know this. Imagine in the conventional medicine, they're not going to have a clue. They're not going to have a clue. So that's in poly-MVA, by the way, for those of you that never heard of it, it's a very good antioxidant. It's the chemotherapy of non-toxic medicine for cancer. It kills cancer cells. It even crosses the blood-brain barrier. And I'm not getting paid by saying this from the company that makes poly-MVA, by the way. I'm not getting paid nothing. I'm just telling you the truth from what I learned in my years of research and my years of treating patients that have this disease. It crosses the blood-brain barrier. It gets to the tumors that are in the brain as well as in the body. So another thing that we need to also understand, especially those doctors that are listening right now that are doing alternative therapy, you cannot cure cancer with two treatments or two therapies. It's unreal. It does not work. Okay? And for those of you out there, and I'm not trying to sound like in a negative tone or anything, I'm just trying to tell you what I've researched, what I learned throughout my years is that just because a fruit is known to cure cancer, you cannot just give that fruit to that patient because there's more to that patient than just a tumor. You also have to help that patient, he or she, with their emotional problems, with their spiritual problems, with their energetic problems, okay? Because the cancer will come back, even if it's a miraculous fruit from the jungle somewhere. Please understand that. So it's very important, and this is why we, stress that. I'll give you an example. Somebody goes to the doctor, the oncologist, and says, you have cancer. What is the first thing that person is going to feel? Fear. They're going to be afraid. If they didn't have that emotion before, overwhelming their spirit, they have it now. Okay? If somebody tells you you're going to die in 6 months if we don't do chemo, what is the first thing that you're going to your body automatically, because we're in this physical body? We have to feel all these different emotions. The first thing that they're going to feel is fear. So I don't know anybody, I don't know any hospital right now. Scripps is doing some stuff here in Southern California where they have now an integrative alternative therapy department, but it's like baby things. They even called me one time and sent me an email about me going there to talk to somebody, but they're like doing baby stuff that we were doing like 30 years ago. So, but the fear, you have to deal with the patient's emotional state, and that's very important, very, very important. I give you an example, and can I give you an example right now, really quick? I'm not sure if I'm talking too much. Okay. I get really passionate about this because it's so important, and it's like my passion to help people as much as possible to understand what they're dealing with here. This is not a joke. This is a very, very aggressive disease, and it has to be really combated really quick. So I had a patient from Australia come to the clinic in Mexico, 3 years ago, and this patient was an Italian man that was 75 years old, and he had stomach cancer with metastasis to the liver. So he was already frail. He had taken chemo and all this other stuff, didn't work. And then he came over, and then I started, talking to him. And obviously, I always ask the patient, can I talk to you about your life and about your emotions and state and this and that? Obviously, they have to consent before I even introduce that with them. So he's like, sure. So we did a few sessions. The man was really rigid, really full of resentment from his family, the family of his wife, and he had that resentment that just, let's think right now. If you have a resentment within yourself, what organ is going to be affected? How does the cancer develop physically in the stomach? First you get an irritation, then you get an ulcer, then you start that ulcer develops into something more and more and more, and then the malignancy happens. The malignant cells happen. You could develop also polyps, but that's more seen in colon cancer, where the polyp is the precursor to the cancer cell itself. So this resentment, let's just say, let's say it in non-scientific ways, it just ate up his stomach, basically. Mm-hmm. So I got to the bottom of it, and I realized this man has resentment towards his wife's family, because his wife's family, they did something to him when they were young, when they had been married for the first few years, and he had never forgotten that. And his wife, helped him with that, or got his back on it or anything like that. So he never let that go. So when he was at the clinic, we did a lot of therapy with him and things like that, and gave him the protocol. On a Friday, his lab work was improving tremendously. We took labs on Friday, and he didn't have any contact with his wife those 2 weeks that he was there. He was there with his son, and then Saturday came, and obviously, there was things that happened Saturday, and then Monday, because when I showed up on Monday, it was a weekend. Usually I have other doctors there. Monday came, and we took labs again because he got sick. And then I looked at the labs, and I showed the physician, the internist. I said, "Look at him. This is like night and day. Everything got worse in 2 days. What happened? Why?" Well, I was trying to figure out what went wrong. What's going on? And I found out through his son that his son was talking to his mom, and then gave the patient the phone on a Saturday night so he could talk to his wife. And that emotional connection there just instigated that the physical aspect of it. You understand what I'm saying to you? How strong an emotional state can do physical damage to a person. So, it's like I've seen this so many times. So it's very important that this gets addressed. Very, very important. And there's a lot of good people out there doing some of this stuff. I mean, they're not doctors, and they're not really treating cancer patients. They're treating just normal people that have emotional problems, and I really respect them and applaud them for doing that stuff. But we need more people to do it. We really need more people to do it, and I think that's one of the preventive methods of this. You have to deal with your emotional things.
Yeah, and stress reduction.
Yeah,
absolutely.
For sure.
And so I want to talk a little bit about radiation. What does radiation do to you, and why perhaps should that be avoided as a cancer treatment?
We have something similar to the treatment of radiation, the therapy of radiation, called hyperthermia. Okay, but there's a difference. Okay, so radiation, what it does, it goes to the spot, to the wherever the tumor is, and pretty much burns the tumor, or burns the area, or burns a certain part of the tumor, so the tumor doesn't grow anymore. I mean, there's different ways to do radiation. And by the way, I'm not an expert on it, but I know about it. So basically, let's just think of it as it burns the tumor. It gets rid of it by like a burn, okay? So the problem with that is that my father had prostate cancer way back, like 20 years ago. I wasn't even like in medical school yet. I think it was 25 years ago, maybe, or 30, I don't know. And so they decided to do radiation on him. They did radiation on his prostate. He had to wear a diaper the rest of his life because of the radiation. I mean, when we're talking about these types of treatments, we also have to worry about the quality of life of the patient, right? Even if he didn't take radiation at the time, he was not going to die. There were other things available, but they decided to give him radiation because, maybe they needed to fill a quota for the month or something at the hospital that he went to, or something like that, right? I don't know the details, but I could imagine. I've seen so much of this. So anyway, that's what radiation does. But then, like when the radiation, it also affects whatever is around it. So for example, in prostate cancer patients, they're going to have problems with the urination, or something might be, the ducts might be torn or something like that, the urethra, the uterus, et cetera. So basically, that's what radiation does. It burns the malignant cells to a point, because there's a lot of times you cannot do radiation on a lot of tumors in the brain, okay, and then in other specific cases. I mean, you can, but it's very, 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 very risky at that. And then if I talk to you about hyperthermia, basically what the hyperthermia does, it heats up the cancer cell. So because cancer cells at a certain temperature for a certain time, they die, just like if they're exposed to ozone or oxygen. Okay, so if they're exposed to oxygen, which is what one of the therapies that we use at our clinic does, it exposes the cancer cells to oxygen, and then the cancer cell dies, because cancer cells cannot live in an oxygen environment. They are not aerobic; they're anaerobics. They used to be aerobics, but then they turned into malignant cells, and they became anaerobics. That's the cycle of a cancer cell. Okay, so they used to be normal cells, and then they mutate. And the normal cells need oxygen. You heard of hemoglobin, et cetera, right? They need oxygen, but the cancer mutation, the cells of when they turn into cancer cells, they mutate and they become anaerobic cells, which means that they live in a non-oxygen environment. So you expose these cells to oxygen, and that's it for them. So basically, same thing with hypothermia. You expose these cells to high temperatures for a certain amount of time, and they die, because their mortality is at a certain number. So what is the difference? The difference is that you don't burn. You don't burn the normal cells. You specifically go to the cancer tumor cells, and you burn those, or you heat them up basically. But the patient does not feel the heat, because you're working also with frequencies, et cetera, et cetera. So you have two types of hyperthermia. You have, actually three types. You have the local hyperthermia, which is called in vivo hyperthermia, and then you have the full body hyperthermia, and then you have the head hyperthermia for cancer in the brain. Okay, and these machines are programmed for each type of location in the body. Okay, so the Germany clinic that we branch out of, they have the highest number of hyperthermia machines in Europe and basically in the world, because there are no hyperthermia machines in the United States. I mean, there are, but they're hidden. I mean, there's a few people that have them, but they're only a few, like one or two machines. Over there in that clinic I branch out with, they have I don't know, I think 10 full body hyperthermias. They have like 5 head hyperthermias, and then they have the local hyperthermia. Like there's like 3 rooms just for the hyperthermia machines. So that's the difference between hypothermia and radiation.
Is hyperthermia similar to an infrared sauna?
No, it's not. Infrared sauna deals with no. The infrared sauna deals with infrared light, and the hypothermia deals with heat at a specific frequency. But the infrared sauna is something good to use, not just for cancer patients, but for really anybody, because we need to detoxify our bodies. I mean, that's one of the main problems that causes this, is that we take care of our, I see all these people at the gym, I see all these people drinking these juices, but sometimes we have to do more. We have to go in deeper into our bodies, not only do detoxification. I mean, there's a lot of detoxification programs out there, but IV detoxification is the best. It's a preventive thing. I don't know if you heard of Hollywood right now. I live close to LA, and I have a lot of friends over there in Hollywood, but what they're doing now, and it's like a detox. They're doing a detox that goes straight to the blood. So they're partying all night, drinking a lot of alcohol, and then they go to, one of these
Hollywood?
I'm sorry?
In Hollywood, they're doing that?
I'm going to tell you what they're doing. But what I'm saying is that a lot of this detox that I'm speaking about is what they're doing now in Hollywood. What they're doing is that they're drinking all night. A lot of, these people that like that kind of life, and then in the morning they go see a doctor, and what the doctor's doing, these doctors got really smart, because now they have another way of helping people and making money. What they're doing is that they're preparing detox IV bags, intravenous bags, and they're giving it to these people that are coming in all dehydrated from the alcohol, because a lot of these people have to work the next day. But you could only drink a certain amount of Pedialyte before you don't want anymore. You get full. You know what I'm saying? Like Gatorade or Pedialyte, et cetera. So the doctors are applying these IV bags, 250 milliliters with a couple of Vitamix, et cetera, et cetera. They're not as intense as the detox IV bags that we use for anti-aging or preventing diseases or for cancer patients. But they are, so they go there, they get their IV fluids in, their vitamins and their electrolytes through the vein. It's the fastest way to get to the blood, and the effect is immediate. Then they're going to feel fine. They're going to all the toxins are going to come out. Not all of them, but a lot of the stuff that they put into their blood and at nighttime comes out, and they're good to go to work or whatever they need to do, go act or whatever, make a movie or something. So in regards to the detoxification, which is part of our anti-aging prevention program, it's very important that we keep that in mind, because at the age of 30, our liver is already has 30 grams, grams. Imagine 30 grams of toxins in our body. Even if we didn't drink alcohol, even if we lived a normal life, we didn't abuse our body, we already have 30 grams of toxins stuck in the liver. And I don't want to get into the medical process of the whole thing, but just so everybody could understand, there's 30 grams already of toxins in our liver. It's like a filter, car filter that doesn't get changed. It gets clogged. You understand? It gets clogged, so the car is not going to function. Same thing with us. I'm not saying that the filter and the car and the liver are synonymous. They're not, but it's a similar example. So what happens with a detox? Sorry?
I know, that's why I use an infrared lamp sauna every day to every other day, because everyone has to detox these chemicals. If they're going to have cancer or another kind of disease, it's inevitable. You have to detoxify all these chemicals and heavy metals, and the infrared sauna is a great way to do that. It's great preventative.
Yes.
And from what I've heard, while you have cancer as well.
Yes, definitely. One of the things usually when patients go to our centers, they're pretty busy all day long. We take care of them really good, and they have to do a lot of therapies, not just the IV program, but they have to do, they get lymphatic massages, they get emotional therapy, they get energetic therapy, DNA activation if they want, and just a lot of stuff, So they're pretty busy. Their day is, depending on their condition, their day is usually from 6 a.m. if they're doing the Gerson diet, all the way to 9 p.m. Because the Gerson diet, you have to do, 5 or 6 coffee enemas throughout the day and specific things like that. So it's pretty busy, it's intense, but the effects and the results are something that they talk about later on. So it's important. But
so you employ the Gerson method at your clinics?
Yeah, we incorporate a lot of different things. Depending on the patient, we make specific protocols for each patient. We don't usually do Gerson on everybody, but we use a lot of, Ms. Gerson, I've known her for a long time, but we use a lot of her methods too. And when we do a conjunct therapy protocol like this, the results are really a lot better. So yes, I do use Gerson. I do use vegan diet, raw diet, there's different things like that people are so passionate about right now, and I'm very happy for them, and I'm glad, and I hope many more people learn about the raw and the vegan and all this other stuff that these wonderful people are doing out there to spread the word and to let humanity grow and shift into a different frequency. So
Do you think
that's
that
another.
everyone that has cancer should be doing a raw vegan diet?
No, no, I don't.
No.
No, I don't.
What kind of
No.
cancers don't jive well with a raw vegan diet? I've
Well,
heard
you have to.
leukemia and blood cancers don't work well with the raw vegan diet.
It's not just the cancer itself, the individual itself. You have to also take into consideration the weight of the patient, the energy of the patient, their condition of the patient. A lot of times, for example, if a patient cannot tolerate food because they have an obstruction, then you could just forget about any diet. You have to go intravenously. So, you know what I'm saying? So, but it all depends on the patient. In regards to cancers that are, like common cancers, it's colon cancer, for example. You cannot give the patient cannot eat, basically, that much. And it's probably Gerson. That will probably be a Gerson thing, and depending on their condition. And but a lot of patients that have, you're right, like the blood diseases, then that'll be good for them. And also like patients that have stage 2 lung cancer or things like that, vegan and raw, it's fine. But we do special things to that kind of diet as well. So
okay.
So
well,
it's very important.
Let's get into some of the natural methods that you use to cure cancer. And if you want to find out more, audience, about more information about the natural cancer treatments that we're about to discuss on today's show, you can visit Dr. Nisim John's website at canceroptions.us. Now, can you explain to listeners what type of natural methods show promise in curing cancer that you employ at your clinics, namely like the Sono-Photo dynamic therapy?
Okay, so you want to talk about the therapies. Okay, so Sono-Photo dynamic therapy is our main therapy, and I say main therapy because it attacks cancers that are discovered and cancers that are not seen yet by the machines and et cetera, et cetera. And Sono-Photo has been around since the 70s. Actually, phototherapy has been in the 70s. In the 70s, they were using, because let me just explain so people can understand. Basically, what Sono-Photo therapy or SPDT therapy is this. You get an agent. The agent is derived from chlorophyll. It's a substance from chlorophyll. And what this agent does, and by the way, this was discovered by a Russian scientist that passed away about 15 years ago, okay? This agent, you introduce the agent sublingually under the tongue to the patient. And it's in capsule form. And basically you introduce a capsule one at a time under the tongue, under special conditions. And the body will absorb the agent, and the agent goes into the body, okay? So you give certain amount of capsules to the patient depending on their weight. So what happens with this agent, as it goes into the bloodstream, it attaches to malignant cells, okay? Once this happens, this takes about between 24 and 72 hours, and depending on the weight of the patient. So what happens with that is that after 72 hours or 48 hours, depending, we expose the patient to light. That's why it's called phototherapy. So light. What kind of light? It's a UV full spectrum light. It's non-toxic light. The agent is non-toxic either because it comes from a chlorophyll and there's nothing added to it, like vaccines. You know how they add all this stuff to vaccines. There's nothing added to this capsule except the substance that will attach itself to the malignant cells. Once we expose the patient to this light for a certain amount of time, which the light does not harm any cell in the body, and it doesn't cause any side effects. The only side effect will be that the cells will die the cancer cells will die once the patient is exposed to the light. Once the patient is exposed to the light, this agent that's attached to the malignant cells opens up and releases light. Now, it'll create an oxygen environment around the malignant cells, and then the malignant cell will die because cancer cells cannot survive an oxygen environment. This happens with phototherapy. Now, there's tumors that are too deep into the tissue for the light to penetrate, so we use sonotherapy. Now, we use an ultrasound machine that has frequencies. It's a special machine. It's not just any ultrasound machine. And we adjust the frequencies and we apply it so the patient feels like they're getting a massage with some little machine, right? And we apply it to certain spots where we believe are deep tissue tumors cells. So basically, it has the same effect. The agent opens up, oxygen is released into the malignant cell itself because it's attached to it. Now, the only thing with the Sono-Photo therapy is called PDT, by the way. And by the way, a lot of people ask me about what are they doing in China? Aren't they doing this in China? In China, they're only doing phototherapy. I know because I flew there in November twice, and I did conferences over there. They're only doing phototherapy. They don't know anything about sonotherapy. Well, they do now because I talked about it over there. But throughout the world, they're doing a lot of phototherapy, and I don't know if all of them are using the correct agent or not. There's only a couple of doctors that know this therapy really good in regards to sono and photo. And if you just use photo, the problem is that deep tissue tumors are not going to be affected by the light. So those are not going to be, reduced in size or shrunk. And also with sono-phototherapy, it doesn't cross the blood-brain barrier, so we cannot use Sono-Photo for the brain. That's why we use other things like poly-MVA to deal with the brain tumors. Now that this Sono-Photo treatment, it's natural, it's non-toxic, it's safe, it's effective, and basically the program is when a patient has cancer and they call me in or they call one of my staff members, the recommendation is that they go to the clinic and they stay 2 weeks at least, depending on their condition, get their Sono-Phototherapy plus everything else in their protocol, and then we send them home with 8 weeks of Sono-Phototherapy that they can do at home. We send them with everything, the machine, the lights, the capsules, and the instructions, and by the time they leave the clinic, they know how to do it themselves or their family member. It's very easy to do. So basically, that's one of the main therapies, and it has, it's been around since the 70s, but it actually started because it was really toxic in the 70s because they were injecting an agent that was toxic to the liver. But I think 15 to 20 years ago, this Russian scientist came up with a better agent, and that's what we're using now. We've been using it for a long time. So that's one of the non-toxic therapies to use. Now, if you include Sono-Phototherapy with poly-MVA IV, which is what we talked about earlier, and this is an antioxidant, you can look it up on the internet if you wish, or email me or something. Then the percentage of effectiveness is even better. But I have to reiterate that we have to do detoxification IV and chelation IV, along with a lot of other things, and then attack the cancer itself. Because if you attack the cancer and you kill these cells or you shrink the tumors, you have to. A lot of doctors don't think about this, but maybe they will if they're hearing this now, is that the dead cells are circulating in the blood, right? They're circulating in the blood. And I was telling this to this patient that called me from Harvard the other day, and I was telling her, well, you have to make sure that once the cancer cells are dead, and she agreed because she's known all this for like a long time ago. They circulate around the blood dead, but they carry stem cancer cells. Do you understand what that means? It means that they're going to grow again. A lot of times, even in chemotherapy patients, they kill everything, but they're circulating. What do they use to get rid of the dead cells? They don't. So a lot of times they're saying, "Oh, the cancer came back." Really, the cancer never left because they're not getting.
That's the question I was going to ask you. Is that a lot of people that do chemo, they don't realize that they're probably going to get it again because one of those reasons. Yeah,
and this is something. I'm not making this up. I'm not making anything up that I'm telling you, but this is like scientists know this, that each dead cell carries a stem cancer cell within them. So basically, they're dead, but they have stem cells. They're circulating around the blood, and then these stem cells create more cells that are malignant. Okay, so what we do with this therapy in regards to what you were asking about the therapies, naturally we give patients IVs that will actually extract these dead cells from the body, like, through the urine or through the stool, and they this is the way to get rid of them. So, and they have less side effects because of that, because the more dead cancer cells that are circulating in the blood, the sicker the patient is going to feel, even though the tumor is shrinking. So that's just, that's one of our main therapies, Sono-Photo therapy. And then we have Laetrile. Laetrile is called amygdalina. It's been around. It's apricot seed. It comes from the apricot seed. I don't know if you heard of it, but this therapy has been around for over 50 years. I was fortunate to talk to one of the doctors that brought it in, into the integrative treatments a long time ago. He's passed away already, and basically what Laetrile does, it's an injection. It can be given orally as well, but the injection is the one we use in the clinic. And basically what it does is stops the metastasis of the cancer. So it has like a 72-hour turnaround period. That means if there's a metastasis going on in the body and the patient comes, gets treated with this, usually around 72 hours of the metastasis or the traveling of the cancer from one place to another in the body will stop. I mean, these numbers can change with every patient. I'm not saying that go ahead and write this down and this is like the only case or the only law, but this is what we've experienced in the time that I've been doing this, over 15 years. So wow. Laetrile, it's also called vitamin B17. I don't know why it's called vitamin B17. Maybe it's a marketing thing, because a lot of countries don't. It's definitely not legal in the United States, and then it's in other countries like in Israel, it's not legal. In Germany, it's legal, but you have to go through a bunch of loops and stuff. And it's called vitamin B17. It's not a vitamin really, but if you want to look it up later, you can. Laetrile is another. It's natural. It doesn't cause any side effects. It doesn't harm the body. It's not a toxin. Because of the way that it's synthesized in the body, it's not poison or anything like that. So that's another. And usually with all these therapies, we always talk to the patient and tell them about what the therapies are, and if they agree. We don't just say, okay, you're here, we're going to just shoot you up with stuff. We discuss all these details with the patient. The patient is like our friend. They get there like our friend, but usually they leave like our family member, because it's bonding is so important to these patients. That's one of the things that they need the most is it's family, it's bonding, it's love, it's compassion, it's understanding of their pain, because it's a painful disease. It's very painful, and the emotion aspect of it is, like I told you before, and I'm going to say it forever and ever, it's so important. So, and then hyperthermia is another one we discussed earlier. It's natural, it's non-toxic. The lymphatic massages, the detox, iron foot detox machines that we use also helps. We include all that. The energy work that we do as well is very important. It's one of the things that I'm really excited about talking to different countries about, and different people, and everybody who wants to hear how important the energy that surrounds our body has an effect on our physical, because it will eventually, if it's not treated correctly, or if it's not in a good positive way, it will affect our physical body. So that's another thing that we incorporate. And if you go to our webpage, there's a list of, they're called, I don't know what they're calling them now, but I think they're called complementary therapies or something on the webpage, where we discuss, Anthropic ray healing, Jikiden Reiki, fascination, mesmerism, clinical hypnotherapy, emotional therapy, DNA activation, life activation, things like that. And there's other ones that are going to be also incorporated on there later on as well. So, these are some of the things. What else do we use naturally? Oh, well, we use a vaccine. There's two types of vaccines that we use. One is called VCAN1, one is called VCAN2. VCAN1 is vaccine that we derive from the patient's own fluids, okay? And we vaccine against the antigens that the cancer cell is extracting or producing and leaving it in the bloodstream. Do you understand? Because cancer cells release protein into the blood, and this protein is made up of antigens, and antigens are actually what attack the immune system, or what the immune system attacks to get rid of the disease or the virus or whatever it is, or the bacteria, whatever it is, or malignant cells. So basically we extract the antigen in the lab from the fluid of the patient, and we create antibodies, and then we inject once it's processed, with all aseptic techniques and everything, filtered and et cetera, we inject it back into the patient, and we create like a stimulation for the immune system. So the immune system of the patient, which has been destroyed usually by chemotherapy, starts being activated again and creating antibodies for the antigens of the tumor cells. That's called VCAN-1. And then we have the dendritic cell vaccine. By the way, VCAN-1, that vaccine, it's only it's like a passive immunity, so it will not work like straight away. It will not work like the next day. It'll take like 3 weeks or a month to start like actually manifesting itself in the body in full force. Then we have VCAN-2, which is a dendritic cell vaccine. This one will work right away. Within 12 hours, the immune system is just going to start producing T killer cells, which are the cells that actually attack invaders, regardless of whether it's malignant cells or viruses or whatever. And then that's called the dendritic cell vaccine. There's more to information than that, but that's basically a generalization of it. So those are all natural, because the dendritic cell vaccine we also get from the patient's blood. So, and we don't add any chemicals or anything that doesn't belong to the patient. You understand? So it's very natural. It's done for patients that have autoimmune diseases, and like HIV and lupus and osteoarthritis or rheumatoid arthritis, et cetera, et cetera. So wow, we also treat those types of patients. Yeah.
Oh, that's really, really interesting. It sounds amazing. It sounds you're so ahead of your time.
Let me just tell you one more therapy that it's not on our webpage because we haven't gotten all the stuff on it, but we've already incorporated it, and it's called Triax therapy. Basically, what we do with this therapy, and by the way, this therapy has also been around forever. I'm not like inventing anything. I'm just getting a lot of knowledge and putting it together and making it like really work for the patient's benefit. And I'm getting knowledge from here, there. I was a researcher before I was anything else, so I did and I've done and I keep doing research. But this strip therapy is called Triax therapy. Triax, tri is 3, ox is oxygen. Okay, so one of the main things when people are sick or when they start aging is that their oxygen level in their blood decreases. If you look at somebody's blood that has cancer, their oxygen level, and don't even about looking at the normal conventional labs like the hemoglobin, you can look at that, that's fine, but there's more to it than that, okay? So their oxygen level decreases, and what happens is that we apply ozone, the gas, we apply hydrogen peroxide, liquid, and we applied oxygen, gas, to the blood of the patient. Now, how do we do this? And basically we take like 150 to 200 of blood out of the patient. Now we expose this blood through a tube into a UV light, which is this light is a special light. It's not the light that we use for the the phototherapy. This light, what it does is it gets rid of parasites, viruses, and I'm talking about viruses like hepatitis C, HIV. I'm not talking about like the little miniature virus. I'm talking about hardcore viruses that supposedly there's no cure for them or whatever. So we pass the blood through this light, okay, and it gets rid of any parasitic activity, any parasites, any viruses, any bacteria, anything that's detrimental to the health of the patient, right? It gets rid of that. So we pass it through the site, and then it falls into another container that's empty, the blood, right? Then when it's all there, the 200 milliliters, we add a certain amount of ozone, a certain amount of hydrogen peroxide, and a certain amount of oxygen. And we turn the bottle upside down, and we send it back to the patient. This is called Triax therapy. And there's only like 2 other people, that maybe 3, I don't know, that are really experts on this therapy. And I was fortunate and blessed to have been trained by one of them, like in the last 2 years. And I've did it on myself many times already. It's just an incredible thing. I've done it on patients a lot. A lot of people ask me about it because it's also an anti-aging therapy that we use with our anti-aging packages and stuff like that. So it's so basically we send it back to the patient, and then you're adding oxygen. You're adding 3 levels of oxygen to the blood, and none of this stuff is toxic. You know, obviously you have to know what you're doing. You got to give them a certain amount of the ozone. You can't like go crazy and give, it's like any drug. It's like a drug. You can't give like 50 Tylenols. Hopefully nobody's taking Tylenols, period. But you cannot do that. You have to get specific dosages of ozone, oxygen, and hydrogen peroxide liquid. And basically the results are like better circulation. The patient can breathe better. A lot of the dead cells are manifesting in the bloodstream. Even if you don't have cancer, even if you're just like a normal individual, you still have dead cells, and the reason why it's very important to do exercise is because once you exercise, you're getting so much oxygen in there that these cells are circulating really fast in your blood, and they're going through your urinary system or your stool. You understand? So that's why, I don't know how many people touch on this in regards to exercise, but this is one of the reasons why exercise is good. I mean, some people cannot exercise because they have debilitating problems with their bones or muscles or whatever, but anything that you could do to oxygenate yourself, even just take oxygen, put it in oxygen like Michael Jackson used to do, it's very good to do. I'm not saying to go do that, but that's just the concept of this therapy, the Triax therapy, is to rejuvenate cells and to get rid of dead cells. That's basically it. Now, if you're rejuvenating cells, you're going to have a better life. Your diseases are going to be less, they're not going to manifest as much. And if you have a disease, it's just going to help you. Your oxygen level is going to be better for you. So that's
I think I'm going to have to come in and do some of that anti-aging therapy.
Oh, yeah, you're welcome. I'll send you all the information. I mean, there's a lot of stuff. I haven't discussed half of it. I'm just discussing the stuff related not only mainly for cancer and a few anti-aging things, but we have really good anti-aging protocols for specific needs. Also, I haven't touched on the hormonal things that are going, all these hormonal problems that women are having, and some men also. I see men also. The treatments that we use for that are natural. There's no synthetic hormone. There's no biological hormone. And for those of you that use biological hormone, you have no idea that these biological hormones are also very unsafe and very toxic. Okay, so that's also part of it. And when we do any kind of treatment, we pretty much do all kinds of tests, not just the standard test, but other tests on the patient, even if they're not cancer, whoever, to see what's going on with their hormones, with their allergies, with their with their cells, their immune system, et cetera, et cetera, et cetera. We even have a test now that I'm so excited about. I haven't displayed it yet, but it's going to be coming in a couple of weeks, that is going to diagnose the chances of that patient having cancer, like 98% accurate. It's just incredible. Yeah, it's incredible. It's incredible. But I will post it on the webpage once it's ready. I haven't posted, but
I'd be very interested
that's going to be part of the prevent. Yeah, that's going to be part of the preventive package as well. So
how long does it typically take to rid the body of cancer using natural methods?
It varies on the patient. I cannot like say specifically. Some people. I had a kid. The kid came in from Ireland or Netherlands. This was a long time ago, like 7 years ago, and he did Sono-Photo therapy and at the clinic for 3 weeks, and then he had leukemia, I believe it was, and they already had told the parents. He was like 9 years old at the time. They already had told the parents that there's nothing else that they could do, and that was it. That to go home and just be with him, the usual story. And then they brought him over here, and they did Sono-Photo for a year at home, a whole year, every day, because you have to do it every day, twice a day. In the morning you do the photo, and then in the evening you do the sono. And the parents were very, very, good with that. And that's one of the things that I stress to the patients. You have to do certain things every day because your life is depending on it, basically, So they did it. He did it for every day. I think he's 16 or 17 now. After a year, he was pretty much cleared of the disease. He had other, I think it was leukemia. So it depends on the patient. It depends on the disease. But we do get results we do see tumor shrinkage within a week, 2 weeks. Sometimes, it takes longer. I can't say like the next day. And by the way, it's not like this. There's not one magic bullet. And there's a lot of things that go on with patients that are dealing with cancer. There's a lot of things, there's a lot of things that we have to take into consideration, and sometimes we just if their lungs collapse because of the chemo and they're destroyed. There's really nothing we could do.
Yeah. So are natural approaches appropriate for every patient? Say if they have late stage 3 or stage 4 cancer, will natural treatments work quick enough?
Yes. Like I told you before, protocol is very, very extended. Like it's full. It's natural treatments are what we do. We do natural treatments. That's it. And every patient, let me tell you, 98% of the patients that we see in all the clinics, not just in one clinic, are stage 4 post chemo.
Wow.
You understand? It's if I get a stage 2, I would throw a party that night with the patient because I'd be so happy that they actually got to us quick. You understand? They didn't wait till the last minute. Because a lot of patients, they wait till there was nothing else conventional medicine could do, so they'd start looking. I mean, a lot of people, but then the universe, God, nature, the light, that there's more of you, Wendy, and other people that are getting the word out, so people can wake up out of this matrix that we're living in, out of this fogness that we're living in regards to that there's more than just that out there. So, unfortunately, more people now are being aware that there's more things out there besides the radiation and the chemo. But, the numbers haven't changed dramatically like I would want them to in regards to getting to me or to us sooner than waiting till they're stage 4, post-chemo, post-radiation, nothing else that conventional medicine could do. And then they come to us, and a lot of times it's like the road is hard, but, we do what we can and help as many people as we can and have success at what we do. So,
are there any cancers that don't respond well to natural treatment? Usually,
natural treatments don't cause any kind of, well, first of all, they're not going to cause any negative effects on the body. But there are chances that they're so far gone that even the natural treatments that we give them will not do anything because their systems are shutting down. Do you understand what I'm saying? Because their systems are shutting down. They're like almost passing, basically. You know, and a lot of times I feel bad, or the doctors feel bad that we tell them, you know, we really can't do anything for you. It's just too late. Don't waste your money. Don't waste your time. Don't waste, you know, don't waste your money. Don't waste your time. I mean, I have I don't know if you saw the video of Lourdes. She's from LA. I mean, she actually came to my house with oxygen, and she's a young lady. She's a beautiful young lady. But when she came to my house, she came to my house because of a friend of mine that knew her, and she was in San Diego, and I just told him, bring her here, come here. I'm not going to be at the clinic, just bring her. And she came to my house with an oxygen tank, could hardly walk. She had like these tumor size on her neck. Oh, it was just like, I looked at her and I felt like crying because of the way she looked. But you know, she hung in there. It was hard. She did a lot of stuff, and now she's healthy. I don't know if you saw the video, but tomorrow we're going to go. I'm going to meet her in LA at the Chinese Theater to see some kind of documentary, and she has a documentary coming out. She's also a director and an actress in Hollywood, and she documents her own story. So she's going to be presenting that documentary in the end of the month or somewhere. They're going to do the premiere and stuff. So that's something that makes me happy, because I remember how she came to my house. Oh my God! And then now I just get emotional about it because of what she's been through. She's really oh my goodness, she's my hero. Strong woman, very strong woman. So
well, you know, I have to say that I truly respect what you're doing, Dr. John, and I can't express enough how much I admire practitioners like yourself that are brave enough and intelligent enough to assert the status quo of chemo and radiation cancer treatment and open your cancer treatment centers all over the world. So please keep doing what you're doing to educate the world about their cancer treatment options. And thank you so much for being on the show.
Wendy, it was an honor. Thank you very much for having me on your show. And hopefully I will see you soon. And we could help a lot of people. I am so happy that you have this program available for people all over the world, and I will tell a lot of people about it overseas so they could keep listening to the great information that you have with other practitioners, other healers, other doctors, or other people that are doing positive things for humanity, not only in the field of health, but also in the field of just being good human beings. You know, there's a lot of people that are angry out there, a lot of people with resentments, and you know, we all are not perfect. We make mistakes, but we have to stay positive, and this is what's going to get the disease in these cancer issues, you know, lower and lower as we progress as humans and become more compassionate and have more humility towards one another. So thank you very much. It was an honor, and keep up the good work.
Well, thank you so much, Dr. John. And so everyone out there, listeners, thank you so much for listening to the Live to 110 podcast. That's it for today.